Hello everyone, welcome to my YouTube channel. My name is Alona. I am a retired nurse and lactation consultant. So today it's going to be another topic that I want to discuss. Some of you have requested that I have to do English version of my breastfeeding teaching because in the previous videos that I have posted mainly for Filipino mothers, but because of that request I am going to do purely English version so that everyone in the world will understand about what is breastfeeding, what is formula feeding, and everyone will know how to fix breastfeeding or formula feeding problems. So specifically today, I want to talk about mixed feeding, which was requested, okay? So in my experience as a lactation consultant, I've seen hundreds of moms crying into our breastfeeding clinic or begging for help on how they can feed their baby effectively, either exclusively breastfeeding or mixed feeding. I advocate for breastfeeding, but to be honest, I salute every mom who's doing the best that they can, even if you're formula feeding or mixed feeding, as long as we are feeding the babies. So today, it's such a big concern. Why? We see all over the news, either you live in Western country or you live not in Western country, there is shortage of formula. There is shortage of milk. Milk from the breast and milk from the formula. So what are we gonna do? So I'm here to help fix that problem or maybe give you some ideas on how we can solve these problems that we have right now. So if you are mixed feeding right now, there may be a reason why you're mixed feeding, and I'm just gonna guess because this is what I've seen in my breastfeeding clinic. So moms do mixed feeding because they think they don't have enough milk. They do mixed feeding because they were discharged from the hospital and there was no lactation consultant and there was no proper breastfeeding teaching. When they come home, their breast gets so engorged, so hard to express milk, they just give up and they decided to have mixed feeding. Or there are moms that they really have no choice because there were some complications during birth. Either the baby had some complications or the mom had some complications that are unable to breastfeed. So that's why they are doing mixed feeding. Or sometimes is the peer pressure, or I call it peer pressure, but not really, the pressure from the partner who doesn't want to hear the baby cries, or the pressure from the in-laws or your own mother that they don't want the baby to starve because they think, again, that you don't have enough milk. Or there are just moms who doesn't have really enough milk. No milk, not enough milk. So those are the reasons why we have mixed feeding. And to be honest, probably 1 out of 10 patients that I've seen in our clinics, maybe about 6 who are exclusive breastfeeding and 4 who are mixed feeding or formula feeding. So again, it's your choice. So why we are mixed feeding is because of some of these reasons that I just mentioned. So think about it. When you have, that's why I call quotation code, not enough milk. And this is most of the workshops that I did. This is what I heard from the parents, okay, from the moms. I think I don't have enough milk. I think I don't have enough milk. Because this is the reason. When they plug in that pump and start pumping, and they're looking at their bottle, they only have maybe 15 mils, maybe 30 mils, and they're thinking, it's not enough. It's not enough. So that's why they think they don't have enough milk without thinking or realizing, or nobody taught them that the plastic flange from the pump is not the same as when the baby is latching and sucking and stimulating and getting that milk. Okay? Because when you're breast pumping, it's really different stimulation of the breast is way different from how the baby is sucking and triggering that milk let down with the release of oxytocin. So it's such a different feeling. And mom would say, I don't have enough milk. this is the only thing I pump out. So that's why I give the formula. So I'm gonna demonstrate it to you. So I know I've showed this one in my previous videos, but just for the sake that this is pure English teaching that I'm doing right now, I really want to explain this. So I have this med cap, which is about 30 mils. 30 mils inside the med cap, okay? So we recommend babies, maybe babies who are maybe 2 weeks old or 3 weeks old. We recommend maybe at least 25 to 30 mils, at least, okay, at least. It depends, again, it varies. If you have a very small baby, or if you have a baby who have really not big appetite, so it depends, So that's why I always say, observe your baby's behavior when you're feeding, okay? Now, for this tiny little balls, we normally do this one like newborn to 10 days or 2 weeks, so that's the size. So for that newborn, 5 days, 10 days, maybe at least 15 mils when you're feeding. Now, if you are in that 1 month, 2 months sizes, so it's gonna be like maybe 30 mils, maybe 40 mils, it depends. Now, after you breastfeed, let's say you breastfeed for 20 minutes or 30 minutes, you breastfeed, and you feel like there was a good tugging and sucking, and you know that the baby was really swallowing. And then after you breastfeed, the baby starts to cry. So the husband hear the baby cry saying, I think the baby is still hungry. Your mother-in-law, your mother heard the baby crying, I think, saying, I think your baby is still hungry. I think you don't have enough milk. That's what I think, I didn't have enough milk. So what happened was, there is a formula ready. It's ready to put in the bottle. So guess what? You've added another maybe 30 mils. So that's the total, let's say 60 mils in one feeding that you did. And your baby's stomach is just like this. Imagine if you have total of 60 or 75 mils in one feeding, and your baby's stomach is just like this. And you feel like the baby is still hungry. So you give another formula without realizing that our breast milk should have maybe about 45 minutes to digest. And that 30 mils of formula or 40 mils of formula you have added will take about almost 2 hours to digest. So could you imagine when the baby cries after an hour and you think again, oh, I think the baby cries because baby's hungry again. You give another 30 mils of formula. What happened to the baby? You overfeed your baby with formula, not with the breast milk. And guess what? Because you overfeed your baby with formula, you're not realizing it, some babies may have bloated tummy. Because we know that formula takes a long time to digest. And it's proven research that it takes a long time to digest. Then when it keeps traveling to the baby's mouth without giving it the time to digest, what would happen? The baby gets stomach cramps, bloated tummy maybe. So the baby cries again because that's what happened, right? Crying is the only way the baby can tell you, okay, the baby will cry because you bundled too much, it's too hot or too cold or too noisy in your house, or there's so much noise around, or the light is too bright, or the room is too dark, or crying is the only way the baby can get your attention, or the baby just needs cuddling. But yet, everyone in the house, or you think the baby is hungry, you think you don't have enough milk. That's the biggest problem in our society right now, and I feel so bad for those moms being discharged from the hospital without proper teaching on how to monitor baby's feeding, on how to identify that the baby is full. So let's say, for example, okay, let's say you give your baby a chance, okay? Maybe you're gonna try this, just see if it works, okay? Maybe 1 or 2 days. If you feel like you have the milk when you're breastfeeding, just breastfeed the baby. Maybe give a chance not to give the formula first, so that you can really tell if you really have enough milk, okay? So when you do that, Count how many poop that day. Count how many pees that day. Weigh the baby if you have a weighing scale. See how many grams the baby weighed during 3 or 4 days that you did not give formula. And that really answers the question, do I have enough milk? If the baby is gaining weight, if the baby is pooping good, the baby is peeing good, the baby is not dehydrated, why need to have mixed feeding when you have this? However, if you want to have a break during the night that the dad can feed the baby with the formula, moms, go ahead. I've been there. I've been a mom. It's so good to have 4 or 6 hours sleep at night. But if you have the milk, don't abandon this. Because by the time you get going that 4 hours, 6 hours during the night, you're not stimulating your breast, you're not even pumping, your milk will slowly decline. So that's few of the reasons why mom do mixed feeding. Again, it's so sad because in our society, in our healthcare system, we don't have enough lactation consultant. In my time, I was the only first lactation consultant in that hospital that I worked. For about maybe 20 years, they never had a lactation consultant. Isn't it sad that breastfeeding should be one of the priorities in our healthcare system? That we need lactation consultant to provide teachings to these moms because the nurses are running around for 12 hours the whole day and they have no time to talk to you about what I talk right now about this kind of problem. So I hope you gain something from this video. I know there's so much problem right now with the formula and the prices is sky high. I don't know if all the moms who cannot produce so much milk can afford to buy formula now. But if you have any questions, ideas that you want me to talk about, either you want to go back to breastfeeding, you want to do relactate, you want to do something else, all these things I'll be able to provide you, of course in English version, so that the whole world will understand. So make sure do your comments from this video, and I hope you share this video because there's so many moms right now who are really struggling on how to build this or maybe do something else with the mixed feeding. So remember, you can always overfeed your baby with formula, but you can never overfeed your baby with your breast milk. Remember that, because again, our breast milk will digest about 30 to 45 minutes. The formula will digest within an hour and a half to 2 hours. So take note of that. It's not all the time that the baby cries, the baby needs milk. Okay? Think about it. So again, if you're gonna ask me, how can I tell if my baby is full? Simple. When you see these hands starting to clench so tight like that, and you can see the wrinkle on the baby's forehead, that means, Mommy, I'm very hungry. I need milk. But when you see these hands, when you're breastfeeding, and you can see the baby's face going to relax and the hands slowly open and relax, that means your baby is full. So those are the signs that you need to monitor up when you're breastfeeding. If you're too busy with your cell phone while you're breastfeeding, you're gonna miss that signs. You're gonna miss those cues. So pay attention, moms. Make sure you pay attention when you're breastfeeding or when you're giving formula, okay? So again, more videos to come. Follow me in my YouTube journey because I did this since pandemic so that I can help so many moms out there who are struggling right now. Thanks for watching. Please, if you like this video, do like this video, do your comment, and please subscribe so that you can help me and I can also help you. Thanks for watching. Bye for now.